Connecticut families still struggle with accessing mental health treatment. Now, this is not a Democratic issue or a Republican issue, because this issue impacts nearly every single family in our state. And as a healthcare lawyer and an activist for disability rights, I'm working every day to ensure that we have mental health parity in our state. So we've heard from countless doctors and families and patients how they struggle to get mental health treatments approved.
My son Jean-Luc struggled with depression and anxiety. Sadly, on April 29, 2016, he lost his battle with mental illness and died by suicide. As most of us know, suicide has become the second leading cause of death in the 15 to 34 age group. This is not acceptable. Last week, I was fortunate enough to speak with Senator Kennedy about SB 384. What he explained to me sounded very similar to what I had experienced with the difficulty of getting access to mental health providers. With my son, I found insurance companies would limit hospital stay to the minimum. He would basically get medicated and released, leaving it up to us as the parents to find quality outpatient treatment, a therapist who would be accepting a new patient, and our insurance. I fought my insurance company for better hospital care, insurance coverage, and access to private treatment. Like cancer or heart disease, Jean-Luc suffered from a catastrophic and ongoing mental illness. Yet access to care using our mental health coverage was limited.
This is a bipartisan issue because there is bipartisan support, there is universal support for the idea that nobody should be discriminated against when they're trying to get mental health, if they're not being discriminated against to get physical health, because they have to be treated the same. And they should be treated the same in not just Connecticut, but across the country. But we know, based on the study that Senator Kennedy read, that that's not happening. And it's not happening exceptionally poorly here in Connecticut. And so I am so excited to have worked with Senator Larson, Senator Kelly, to get this bill out of our committee on a bipartisan basis.
This is much more than parity. I think it's just genuine consumer protection. I think that there's an expectation, frankly, when you buy an insurance policy, that you're going to be afforded a particular amount of coverage. And if you look at people who are buying large amounts of insurance, look at the state of Connecticut, look at large employers that are faced with this, and then we also start to see some of the stuff manifesting itself in PTSD accounts and so forth. So we're working on this at all angles. But again, I go back to, I think when you purchase an insurance policy, there's an expectation that you're going to be afforded, particular coverage. And I think that the more data that we can gather, the better resources we'll have. Hopefully, at some point, we can look at how this might be affecting folks at a very, very local level and get them the coverage and the protection that they need.
If you have a serious health issue, physical health issue, you are treated in the state of Connecticut. But if you have a mental health issue, you are running around in circles trying to get help. And it's just simply not right. So I'm really excited that we work together to put this bill together. It's data that will help us build upon and get to where we do need to be.